Welcome! Today we are diving deep into one of the most vital, yet least visible, corners of the medical world, pathology. We're going to pull back the curtain and solve a few mysteries. So let's get this investigation started.
Think about it. You go to the doctor, they take a little biopsy, maybe some blood, or a quick swab. Then you go home and you wait. But have you ever really wondered what happens in between? What kind of incredible journey does that little sample go on?
Well, it turns out that sample is basically the key piece of evidence in a super high-stakes investigation. And the people leading the charge? They're pathologists. The unseen heroes. The medical detectives working behind the scenes to solve your body's most complicated cases.
All right, so let's get right down to it. Who exactly are these medical detectives, and what is this science they practice? What is pathology?
Okay, so the word itself comes from Greek. You've got pathos for disease and logos for study. So the study of disease. But, it's so much more than that. The best way to think about it is as a bridge. It's this absolutely crucial bridge that connects all that basic science, anatomy, biochemistry, directly to the medicine that happens at a patient's bedside. It's the link that makes it all work.
Now, to solve any case, a detective has to understand the language of the crime, right? Well, for a pathologist, that means they have to master the language of disease itself. And that starts with a really basic question.
You see, from a pathologist's point of view, a disease isn't just about feeling sick. It's something measurable. It's a real, tangible deviation from what's considered normal. Something has changed in the body, structurally, how it functions, or even chemically. It's a clue, a solid piece of evidence that something is off.
And this brings us to a really important difference. You have symptoms and you have signs. A symptom? That's what you, the patient, feel. It's subjective. You say, I feel pain. A sign, though, that's something different. That's an objective, measurable thing a doctor can find, like high blood pressure. Pathologists, they live in the world of science. They deal with the hard evidence.
So, what's the first question any good detective asks? Who done it, right? Well, in pathology, they call that etiology. It's the hunt for the cause of the disease. What's the agent, the culprit, the thing that started this whole mess?
But finding the cause isn't always so simple. You've really got two kinds of clues. First, there are predisposing factors. These are the risk factors that might make someone more vulnerable, like obesity. But then you have what's called the exciting factor, and that is the smoking gun. It's the direct cause, the specific virus or bacteria that actually triggered the disease.
Okay, so once you know the cause, the next job is to figure out the story. How did this all unfold? That's what pathogenesis is. It's the sequence of events, the step-by-step story of how that initial trigger led to the full-blown disease. It's literally the timeline of the crime.
So, our medical detectives, they understand the language. Now what? Well, now they need to go out and collect the evidence. And in the world of pathology, that evidence is almost always a piece of tissue or some cells from the body.
And believe me, their toolkit is incredibly precise. Depending on the crime scene, they might take out the entire suspicious area. That's an excisional biopsy. Or maybe just a small piece with an incisional one. They can take a tiny sample from the skin with a punch, go deep inside an organ with a needle, or even just draw out some fluid. Each method is chosen very carefully to get the best possible clue with the least amount of fuss.
The evidence has been collected, so now we get to go behind the yellow tape, into the inner sanctum, the pathology lab. This is where the real magic, the real detective work, begins.
So, that little piece of tissue goes on this incredible journey. First, it gets preserved in formalin. That's fixation, to stop it from decaying. Then comes grossing, where the pathologist actually looks at it with their own eyes and picks out the most important bits. Those key sections are then processed, put into wax, and sliced thinner than a human hair. I mean, unbelievably thin. Then, those slices are stained with special dyes, making all the different parts of the cells light up in bright colors. And only then, finally, is the slide ready for the pathologist to put under the microscope and solve the case.
And let me tell you, you cannot underestimate that very first step. Good fixation is everything. If the evidence isn't preserved perfectly right from the get-go, the entire investigation could be compromised. Seriously, it is the one thing that has to be done right for an accurate diagnosis to even be possible.
Now, this whole process, it can take hours, sometimes days. But picture this. A surgeon has a patient on the operating table. They find a lump. They need to know right now, is this cancer? Do I need to remove more tissue? They can't exactly wait around for a couple of days. So, what do?
The answer is something called the frozen section. It's amazing. In this procedure, the tissue is flash-frozen solid, sliced, stained, and looked at in just a matter of minutes. The pathologist then gets on the phone to the operating room with a diagnosis, literally guiding the surgeon's hands in real time. It's just an incredible display of speed and skill when the pressure's on.
So after all the clues have been gathered, all the evidence has been analyzed, it is time for the final, crucial stage of the investigation, delivering the verdict, or in medical terms, giving the diagnosis.
And that final report from the pathologist, it might be one of the most powerful documents in all of medicine. It's what gives the illness a name. It determines the entire treatment plan. Is it going to be surgery, medication, chemo? It helps inform the prognosis, and it becomes the baseline for checking if the treatment is actually working. Literally every single step that comes next is influenced by the pathologist's conclusion.
And that word, prognosis, that's so key. Because based on all the evidence, what kind of cells are they, how aggressive do they look, how far have they spread, the pathologist helps forecast the likely outcome of the disease. It's the detective's final assessment, predicting what the future might hold based on the cold, hard facts of the case.
So, the next time you hear the word pathology, don't just picture a sterile lab. Picture a busy detective agency, full of people working tirelessly to decode the mysteries hidden deep inside our own bodies. It really makes you wonder, doesn't it? What other secrets are hiding in our cells, just waiting for the right medical detective to come along and find them?